The Health Department in the Free State is concerned about a rising number of children under the age of 5 who are dying from acute malnutrition. The province has seen an increase of 6.5% in the number of children dying from malnutrition, which has now been exacerbated by the impact of the COVID-19 pandemic. Let's take this further with the Free State Health MEC, Montseng, Tsui. MEC, good morning and welcome to the program. So why are children in the Free State dying of acute malnutrition in this day and age?
Good morning, Tembegile and the viewers at home. Our problem is that we've seen this increasing since 2021 to 2022. That is, we saw the malnutrition increasing from 4.2 in 2021. From 4.2 to 5.5 per 100 babies. And we believe this is just maybe the issue of lack of food at home, especially because we saw this increasing just after we have had COVID-19. So maybe the food that was at home, then people lost their jobs and everything. So we started seeing that. But what we are doing, we've got interventions that we are doing as a department. We are educating our mothers how to feed their babies, especially those that are very young. We say, please continue with the exclusive breeding from feeding from birth up until 6 months, because mixed feeding causes malnutrition. One other thing that we are telling them is that you can use the food that you grow in your own vegetable garden, just a small vegetable garden, that can help to prevent malnutrition. One more thing is for mothers that are pregnant to visit the clinic before 20 weeks so that we are able to do all the tests and put in the interventions to prevent the malnutrition. The other thing that causes malnutrition is bottle feeding. If the mother is bottle feeding, we know that the milk is very expensive, especially for people that are not working. Then you would see mothers diluting the milk not to what it should be, like the instructions that are on the formula that tells you what is it that you must mix so much with so much water, so that it can take them a long time, and that leads to severe malnutrition.
So, MEC, pardon me, I would just like to come in there. I hear you on the interventions that you've just recently touched on in your budget vote in this past week, but the fact that there's been an increase in the number of children under the age of 5 who've died of acute malnutrition in the Free State in the last year suggests one of two things: that people weren't aware of the help that's available, or that the Free State government has had a period where there was a lapse, a failure to respond speedily, because this was already a problem at the beginning of the pandemic.
Yeah, I think because most of our community health care workers at the time were working with us in trying to fight the issue of the COVID, there was a lapse. And then right now, when they visit the homes of the people, we tell them that they must look for the children under 5 and make sure that they take the weight, the height and everything, so that they're able to detect if there is failure to thrive, because that is also a sign for malnutrition. As long as we can get the signs before, when it is still at the moderate, we are able to then prevent it by putting in these interventions. So the problem is when you get it, when it is severe acute malnutrition, then that is a problem, because then there's a threat of a baby dying at the time.
There's also the issue of how quickly you are able to respond, because time is of the essence when these are cases that are found, as you were saying, sometimes already at their most extreme, and the children sadly die.
Yes, so we are trying with all that we could. Our teams right now visit the families, the community health care workers, together with the team leaders, that is the professionals. They visit the homes, and we also visit the ECDs, so that we are able to detect at least when it is still moderate acute malnutrition, so that we are detecting it, and then we can prevent the death. What worries us as the department is the deaths due to severe acute malnutrition. We are also trying to educate the community through the community radio station, and apart from them going to the clinic, we also have slots in the community radio stations where people can then hear us, and we advise them on how to feed their children under 5.
Which areas are worst affected in the Free State?
The worst areas that are affected is in the eastern Free State, that is in Thabo Mofokeng district.
Mm-hmm. And in terms of the severity, the response that you now have underway, do you have enough people to sort of go into the communities and do this assessment work? Because waiting for children, for example, to present at a clinic when they're already sick is too late.
We do have enough people. Remember the tools that we have been using in fighting the COVID-19. We've now brought them back to do what they had been doing before COVID started, to visit the families and check everybody in the family, but especially now to concentrate on what we are having as a problem of the children under 5.
Mm. How much of a role does child neglect play in the hunger crisis in the Free State among these under 5s?
That it also plays a role, especially now we have problems of many parents have passed away due to COVID-19, and then you find that the other children are looking after their young siblings, and they don't really know what is it that they should feed their young ones, or they don't even have the necessary food. That is why we are also providing the supplements as the department, and also working with other departments like SASA, where we request the food parcels for the children, where we find that they are child-headed families and this child is unable to look after the child. And some of them, if need be, we have to take them into our children's homes so that we look after them.
And the other context of this MEC, this crisis, and you touched on it slightly with COVID costing people their jobs, but generally South Africa does have an employment crisis. The social security grants, helpful as they are, we're reminded daily with the rising cost of living, people are paying more for food, for fuel, that those allocations also need to be relooked.
Yeah, the allocation is too little, especially where you find that there is no one that works in the family. That money would not be able to buy the necessary food for the whole family.
Thank you very much, Free State Health MEC Montseng Tsui. Good to speak to you, but it's a very depressing topic. Children under the age of 5 increasingly dying of acute malnutrition in the Free State. You're watching